Hey, this is Dr. Pearl, Fitfoot U. So today we're going to review what do you do if you think you might have gout and we got a uric acid of 7 plus, patient that's on allopurinol. So we know this much. He does have gout because he's placed on allopurinol. But what do you do to make sure that this is a flare of gout? How do you confirm? When it's not florid in the sense that it's so fluctuant that you can just pop it and get the gout crystals. So if you want to confirm it another way, and your x-ray findings in this case were pretty non-specific, just a mild degeneration, some soft tissue swelling, here's another way, and I owe this tip to an old colleague of mine, John Cosarelli. So it's called the double contour sign. I'm not sure that he's the first to describe it, but he actually describes it very well and some techniques to get it better. So here's what we're going to do. We're going to take a look at the sonogram itself. We're going to do a tight up on the sonogram. So sonogram's a way that you can get a refractory signal that will show you what's called the double contour. So just below my forefinger where I'm blocking out the patient's name, we will see the double contour sign. So it's almost like a rainbow that is glistening, and it's literally the crystals in the sonogram, in the probe, are refracting off the gout crystals. And where would you put the probe so you know where to find it? Here's the tricky part of this. You're not always going to find it where you think you're going to find it. So everybody's intuition would be, let me just come in here on the side of the, or on top of the foot. Sometimes you got to do it on the side of the foot right there. So that's how you do it. That's how you get your confirmatory double contour sign for gout. Till next time, this is Dr. Ben Pearl with Fitfoot U.